Lupus is a chronic autoimmune disease that has been gaining more attention in recent years. But what exactly is lupus, and why are more people being diagnosed with it? In this video, we'll explore the basics of lupus, how it affects the body, and the reasons behind the increasing number of diagnoses. Whether you've heard the term before or are completely new to the topic, this journey will help you understand the essentials of lupus and its impact on people's lives. Let's start by breaking down what lupus actually is and why it matters. Lupus, also known as systemic lupus erythematosus or SLE, is an autoimmune condition. This means the body's immune system, which normally protects against infections, mistakenly attacks healthy tissues. Lupus can affect many parts of the body, including the skin, joints, kidneys, heart, and even the brain. The symptoms can vary widely from person to person, making it a complex and sometimes confusing disease to diagnose and manage. Understanding lupus starts with recognizing its autoimmune nature and the broad range of symptoms it can cause. When someone has lupus, their immune system becomes overactive and can attack various organs and tissues. This can lead to inflammation, pain, and damage in different parts of the body. For example, lupus can cause joint pain and swelling, skin rashes, kidney problems, and even issues with the heart and lungs. Because lupus can affect so many systems, it's sometimes called a great imitator. Its symptoms often resemble those of other diseases, making diagnosis a challenge. The symptoms of lupus are wide-ranging and can come and go. Some of the most common signs include fatigue, joint pain, skin rashes, especially a butterfly-shaped rash across the cheeks and nose, fever, and sensitivity to sunlight. Some people may also experience hair loss, mouth sores, and chest pain. Because these symptoms can be mild or severe and may overlap with other conditions, lupus can be difficult to identify early on. Lupus can affect anyone, but it's most commonly diagnosed in women, particularly those between the ages of 15 and 45. It's also more prevalent among people of African, Asian, Hispanic, and Native American descent. While genetics play a role, environmental factors and hormones are also believed to contribute to the risk of developing lupus. Understanding who is most at risk can help with early detection and management. There are several types of lupus, with systemic lupus erythematosus, SLE, being the most common. Other forms include cutaneous lupus, which mainly affects the skin, drug-induced lupus caused by certain medications, and neonatal lupus, which affects newborns. Each type has its own set of symptoms and treatment approaches, but all involve the immune system attacking the body in some way. Normally, the immune system protects the body from harmful invaders like bacteria and viruses. In lupus, however, the immune system becomes confused and starts attacking healthy cells. This leads to chronic inflammation and damage to tissues and organs. Scientists are still working to understand exactly why this happens, but it's clear that the immune system plays a central role in lupus. Over the past few decades, more people have been diagnosed with lupus. This doesn't necessarily mean the disease is becoming more common, but rather that doctors are getting better at recognizing and diagnosing it. Improved awareness, better diagnostic tools, and more research have all contributed to the rise in reported cases. People are also more likely to seek medical help for unexplained symptoms, leading to earlier and more accurate diagnoses. Modern medicine has made it easier to diagnose lupus. Blood tests that look for specific antibodies, such as anti-nuclear antibodies, ANA, are now commonly used. Imaging tests and biopsies can also help doctors confirm a diagnosis. These advances mean that people who might have gone undiagnosed in the past are now being identified and treated earlier, improving their quality of life. Awareness campaigns by health organizations and patient advocacy groups have played a significant role in increasing lupus diagnoses. These campaigns educate the public about the symptoms and encourage people to seek medical advice if they notice warning signs. As a result, more people are being tested for lupus, leading to higher diagnosis rates and better support for those affected. While genetics play a role in lupus, environmental factors are also important. Exposure to sunlight, certain infections, and even some medications can trigger lupus symptoms in people who are genetically predisposed. Researchers are still studying how these factors interact, but it's clear that the environment can influence who develops lupus and when symptoms appear. Not everyone exposed to environmental triggers will develop lupus. Genetics play a key role in determining who is at risk. If you have a family member with lupus or another autoimmune disease, your chances of developing lupus are higher. Scientists have identified certain genes that increase susceptibility, but having these genes doesn't guarantee you'll get lupus. It just raises the risk. Lupus is much more common in women, especially during their childbearing years. This suggests that hormones, particularly estrogen, may play a role in triggering the disease. While the exact relationship between hormones and lupus isn't fully understood, researchers believe that hormonal changes can influence the immune system and contribute to the development of lupus. Lupus is more prevalent in certain ethnic groups, including African, Asian, Hispanic, and Native American populations. These groups not only have a higher risk of developing lupus, but may also experience more severe symptoms. Understanding these differences is important for doctors to provide the best care and for researchers to develop targeted treatments. Living with lupus can be challenging, but many people manage their symptoms and lead fulfilling lives. Treatment usually involves medications to reduce inflammation and suppress the immune system. Lifestyle changes, such as avoiding sun exposure and managing stress, can also help. Support from family, friends, and healthcare providers is crucial for coping with the ups and downs of the disease. There is no cure for lupus, but treatments can help control symptoms and prevent flare-ups. Common medications include nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, antimalarial drugs, and immunosuppressants. The choice of treatment depends on the severity of symptoms and which organs are affected. Regular checkups and open communication with doctors are key to finding the right treatment plan. Lupus symptoms can flare up and then subside, sometimes without warning. Managing these flares involves recognizing early warning signs, taking medications as prescribed, and making lifestyle adjustments. Avoiding known triggers, such as sunlight and stress, can help reduce the frequency and severity of flares. Keeping a symptom diary can also be useful for tracking patterns and communicating with healthcare providers. Early diagnosis of lupus is crucial for preventing serious complications. The sooner lupus is identified, the sooner treatment can begin, reducing the risk of organ damage and improving long-term outcomes. Regular checkups and being aware of the symptoms can make a big difference in managing the disease effectively. Diagnosing lupus can be difficult because its symptoms mimic those of many other diseases. There is no single test for lupus. Instead, doctors use a combination of medical history, physical exams, blood tests, and sometimes biopsies. This process can take time and may require visits to several specialists before a definitive diagnosis is made. Blood tests are a key part of diagnosing lupus. Doctors often look for anti-nuclear antibodies, ANA, which are present in most people with lupus. Other tests may check for specific antibodies, inflammation markers, and organ function. While these tests can provide important clues, they are not definitive on their own and must be interpreted alongside other clinical findings. In some cases, doctors use imaging tests like X-rays, ultrasounds, or MRIs to look for signs of organ damage caused by lupus. Biopsies, especially of the skin or kidneys, can provide direct evidence of lupus-related inflammation. These tools help doctors confirm the diagnosis and determine the best course of treatment. While lupus is most common in adults, children can also develop the disease. Pediatric lupus often presents with more severe symptoms and can affect growth and development. Early diagnosis and specialized care are essential for managing lupus in children and helping them lead healthy, active lives. Women with lupus can have healthy pregnancies, but they are at higher risk for complications. Careful planning, regular monitoring, and working closely with healthcare providers are important for ensuring the best outcomes for both mother and baby. Some medications may need to be adjusted during pregnancy to protect the developing fetus. Living with a chronic illness like lupus can take a toll on mental health. Depression, anxiety, and stress are common among people with lupus. Support from mental health professionals, family, and friends can make a big difference. Managing mental health is just as important as treating physical symptoms for overall well-being. Support networks, including patient organizations, online communities, and local support groups, provide valuable resources for people with lupus. These networks offer information, emotional support, and practical advice for managing daily life with the disease. Connecting with others who understand the challenges of lupus can be empowering and comforting. Ongoing research is helping scientists better understand lupus and develop new treatments. Clinical trials are testing innovative therapies, and advances in genetics and immunology are opening new doors. While there is still much to learn, the future looks promising for people living with lupus as science continues to make progress. Managing lupus is a daily effort. People with lupus often need to balance work, family, and social life while coping with unpredictable symptoms. Planning ahead, setting realistic goals, and prioritizing self-care are important strategies. With the right support and management, many people with lupus lead active, fulfilling lives. While there is no specific diet for lupus, eating a balanced and nutritious diet can help manage symptoms and support overall health. Some people find that certain foods can trigger flares, so keeping a food diary may be helpful. Staying hydrated, limiting processed foods, and focusing on fruits, vegetables, and lean proteins are good general guidelines. Regular physical activity can help reduce fatigue, improve mood, and maintain joint flexibility for people with lupus. Low-impact exercises like walking, swimming, and yoga are often recommended. It's important to listen to your body and avoid overexertion, especially during flares. Consulting with a healthcare provider before starting a new exercise routine is always a good idea. Many people with lupus are sensitive to sunlight, which can trigger skin rashes and flares. Protecting the skin by wearing sunscreen, hats, and protective clothing is essential. Staying in the shade and avoiding peak sun hours can also help prevent symptoms from worsening. Stress can worsen lupus symptoms and trigger flares. Practicing stress management techniques such as meditation, deep breathing, and mindfulness can help. Building a strong support network and setting aside time for relaxation are also important for maintaining both physical and mental health. Regular checkups with healthcare providers are essential for monitoring lupus and adjusting treatment as needed. These visits allow doctors to track symptoms, check for complications, and ensure that medications are working effectively. Open communication with your medical team helps catch problems early and keeps you on the best path for managing lupus. Medications used to treat lupus can have side effects, ranging from mild to serious. Common side effects include weight gain, increased risk of infections, and mood changes. It's important to discuss any concerns with your doctor and never stop taking medication without medical advice. Managing side effects is an important part of lupus care. Because lupus and its treatments can weaken the immune system, people with lupus are more susceptible to infections. Practicing good hygiene, staying up to date with vaccinations, and avoiding contact with sick individuals are important preventive measures. Promptly reporting any signs of infection to a doctor can help prevent complications. Managing lupus at work can be challenging, especially during flares. Open communication with employers and colleagues, flexible work arrangements, and knowing your rights can help. Many people with lupus are able to continue working with the right support and accommodations. Travel is possible for people with lupus, but it requires extra planning. Packing medications, protecting against sun exposure, and having a plan for medical emergencies are important steps. Consulting with your doctor before traveling can help ensure a safe and enjoyable trip. Lupus can have a significant financial impact due to medical costs, medications, and potential loss of income. Navigating insurance, seeking financial assistance, and accessing community resources can help ease the burden. Patient advocacy organizations often provide guidance and support for managing the financial aspects of lupus. Chronic illness can affect relationships with family, friends, and partners. Open communication, understanding, and patience are key to maintaining strong relationships. Support from loved ones can make a big difference in coping with the challenges of lupus. Children of parents with lupus may have questions and concerns about the disease. Open discussions, age-appropriate explanations, and reassurance can help children understand and cope. Family counseling or support groups may also be beneficial for families affected by lupus. There are many myths and misconceptions about lupus. Some people believe it's contagious or only affects women, but these are not true. Raising awareness and providing accurate information can help dispel myths and reduce stigma for those living with lupus. Media coverage of lupus has increased, with more stories highlighting the experiences of people living with the disease. Celebrities and advocates sharing their journeys have helped bring lupus into the public eye, encouraging others to seek help and support. Lupus affects people worldwide, but access to diagnosis and treatment varies by country. In some regions, lack of resources and awareness can delay diagnosis and limit treatment options. International organizations are working to improve lupus care and education around the globe. The future of lupus care is promising, with ongoing research focused on better understanding the disease and developing new treatments. Advances in genetics, immunology, and personalized medicine are paving the way for more effective and targeted therapies. Continued support for research and patient advocacy will be key to improving outcomes for everyone affected by lupus. Lupus is a complex autoimmune disease that can affect anyone, but is most common in women of childbearing age. While the number of diagnoses is rising, this is largely due to better awareness and improved diagnostic tools. With early diagnosis, proper treatment, and strong support networks, people with lupus can manage their symptoms and lead fulfilling lives. Ongoing research and advocacy continue to bring hope for the future. Understanding lupus is the first step toward supporting those affected and promoting better health outcomes. As awareness grows and science advances, more people are getting the help they need. If you or someone you know is experiencing symptoms of lupus, reaching out to a healthcare provider is an important step. Together, we can continue to raise awareness and improve the lives of people living with lupus.